Guess I got to use a pen on this now. You could take the roll, please.
Alderman DeHaan. Fair. Hart. Helding.
Present. Oh.
Kaplan. Brian Becker. Marcus. McCarthy. Morganroth. Mosel. Shakur. Shields. Widener. Weiser. Wisniewski.
Thank you very much. Before we get started, if only because it's his first time here in his official capacity at a council meeting of any sort, I'd like to welcome Chief Howell to the room. Once you're in, we stop genuflecting to department heads, so that was it. With that, do we have a motion to approve the minutes from the February 7th meeting? Thank you very much. If there's no objection, the minutes will be approved. And we'll move on to our first and only item, which is 127544. This is a communication from the Greater Racine Collaborative for Healthy Birth Outcomes, requesting to present a project update to the Common Council at the Committee of the Whole. Here they are. If you want to get started, I'll let you introduce yourselves and run with it.
Thank you very much. We are very pleased to be able to be with you this evening. My name is Carol Johnson. I'm the Director of Community Programs at the Johnson Foundation, and I am a resident of the City of Racine, 2nd District. Before I introduce my colleagues who will also be presenting today, I do want you to know that Debbie Embry, back there, who you've never seen before, but no. Debbie Embry is a valuable member of the collaborative. She is also serving on the steering committee for the Oversight and Advisory Committee of the Wisconsin Partnership Program. We are part of the Wisconsin Partnership Program. It's a Life Course Initiative project, which you'll hear more about later, but we're really delighted that Debbie is involved in this at a statewide level, and know she will represent Racine very well. I also want to point out that Dottie K. Bowersox, your Director of the Health Department here, is a member of the collaborative as well, as is Chief Howell. And they've both been very active, and so we're quite delighted to see them here tonight. With that, I'd like to introduce my colleagues and friends. Sharon Schulz, who is the CEO of the Racine-Kenosha Community Action Agency, and she is going to be leading the collaborative in this next round. Samantha Perry is the program manager for this particular project with the Greater Racine Collaborative for Healthy Birth Outcomes, and she is our hardworking staff person. With that, I'm going to turn the program over to Samantha, who will start out. We kind of are doing our presentation as a tag team, so we hope that you will also please feel free to engage in questions as we go along, or you can save them to the end, whichever you prefer. We would like to make this a session that engages and has dialogue. So with that, I'm going to turn it over to Samantha.
Good evening. Well, I will start. First, I want to draw your attention to the flyers you have on your desk there. The first one is for our community baby shower that we are holding during the entire month of April. On that flyer, you have drop-off sites, so if you happen to have some new baby clothes that are sitting around that your children or grandchildren grew out of very quickly, they are more than welcome, and those items will go to families here in Racine, as well as a flyer for our community forum that is taking place on April 25th, where the broader community will have an opportunity to learn more about what we're doing and receive the update. So our title slide is, Are We There Yet? And it's really a testament to the work that we've been doing to reduce African American infant mortality in Racine. For those who don't know, a 3-year average of infant mortality in Racine And what that really means is that over the course of 3 years, we've looked at the number of babies that have died before the age of 1, and that's about 20 babies per 1,000 births, which in itself is an unacceptable disparity. If you look at the slides, you'll see that there's a huge disparity, especially over the past 4 years. We don't really have any updated data for 2011 at this time, but one thing that I can share with you is I've been made aware within the past month that 2 African American babies have died in Racine within the past month. So what are some of the reasons, some of the causes? Well, one of them in particular, we were able to find out that preterm birth, babies that are born before 37 weeks of gestation, have a higher risk of dying before the age of 1. As you can see, that we're not really making a dent. African Americans still have a higher percentage of babies that are born too soon. Another particular reason for this phenomenon is, of course, babies that are born too small, less than 5.5 pounds, we call low birth weight. Those 2 factors weigh heavily on the health of an infant, especially as they become older, because usually they have a lot of other issues such as respiratory problems and things of that nature. So in the work that we're doing, we're using the platform of the life course approach, which basically says that things that happen along the life course of an African American woman have an impact on her ability to carry a child first full term. For example, things that my mother went through, good, bad, in between, had an impact on how long she was able to carry me, and that also plays a role with myself. As you can see, this is more so a visual of places during the lifespan of a woman where things good and bad can happen in terms of health access, in terms of community involvement, in terms of any inequities that come across her path. And also beyond pregnancy, beyond the first pregnancy, in between pregnancy, is another point in when things can still continue to affect her. Now, this particular perspective applies to all African American women. It isn't simply just teen moms that are having this problem. It's individuals or women at the age 25 and up. So an individual such as myself could possibly be in a position where my child might come too soon. I have a cousin who actually gave birth 5 months into her pregnancy and lost both children all in 1 year. And it isn't simply just individuals who may or may not have an education, because the fact that African American women with a college education have a higher rate of losing a child than a white woman without a college degree. So let's look at Racine in terms of what's going on and where we thinking this is occurring. What you can see is something you're probably familiar with are the census tracts of Racine. You can see that the areas that are darker are the areas where there are a higher percentage of African Americans that live in Racine. So taking that same type of map and looking at clusters, if you will, of infant and fetal death, you see the areas that are darkest are the areas where you have a higher cluster of 9 to 12 deaths, for example, in a year in particular. So as you see, it isn't, as we know in Racine, that all African Americans don't per se live in one area. It's a very dispersed area, but you can also see that this is happening across everyone's census tract. This is everyone, this is a city issue. It isn't one area of a city. So with that being said, I'm going to go ahead and start a video here that's really about the collaborative. It's about women who have experienced loss, almost loss, and the stress that it provides them and gives them when they're trying to carry the next child, as well as leaders and what we're doing in the collaborative.
So you should all feel very proud to be in this community, and I know that you represent the community, but one of the reasons you should be proud is that while we have this issue of this high rate of African American infants dying, we also have a group of over 120 citizens who've come together and have made a commitment to determine that there is a way to turn this around. And that's one of the things that we're here to talk about and to make you clearly aware of and to make a point of how valuable this is. So individuals from health backgrounds, from human services, education, local governments, as we've talked about the folks who are here today who are part of this, faith-based organizations, folks from insurance companies, from HMOs, as well as individuals who are not professionally involved in any of these areas have come together on a regular basis to make a determination as to how we can stem this issue. And one of the reasons that it's important is not just that it's not acceptable to have too many babies dying, but is it a measure of many other things in the community. And so the degree to which this gets solved or not solved really has broader impacts for the health, well-being, and welfare of all individuals in the Racine community. So starting back in 2008, there was a group that was already looking at the issue of infant mortality in Racine and why was it so high and what was it we were going to do differently. But along came an opportunity through the Wisconsin Partnership, and they are in fact a group that was received some funds. They really operate like a foundation in Madison under the School of Public Health, and they had determined that one of the important pieces that they wanted to look at was throughout the region, the southeast region, for Racine, for Kenosha, Beloit, and Milwaukee, this was the area in which African American babies were dying at a rate that not was just higher than the rest of the state, but across the nation, when they looked comparatively, Wisconsin was not faring well. And so they determined that they wanted to take a regional approach, invest dollars, and see that we were going to work toward creating this kind of change. So in 2010, we received what they called a planning grant. And that was really a part of then bringing these folks together, which is now over 120, started with a smaller group, but people have continued to, as they understand this issue, wanting to be involved. And so we have continued to grow. From there, we have moved forward, meeting on a monthly basis, creating a community plan. And so one of the items that you have in front of you is in that booklet, really a summary of the plan. So we have these 5-year goals that we've talked about: to reduce African American infant deaths by 50% by 2017, and to also reduce by 25% the incidence of low-weight infants. And as you saw, and as Samantha mentioned, we understand that babies born too soon are more likely to not make it to that first birthday. So those are the goals. And how then do we plan on reaching it? Well, the reason for this collaborative coming together is that we also became a learning community. And so while there were pieces of information that we all had, we also had an opportunity to have experts come in and provide information to us and help us to begin to formulate how we were going to attack this problem. Now, we also had, as I said, the support from the partnership to do this planning grant, and we had some guidance around the life course. So we looked at improving health care services, our ability to strengthen families, and to address some of the social and economic inequities as part of what becomes really central and important to how we begin to turn this issue around. And these are also the same kinds of issues that I'm fully aware of that on a regular basis you're dealing with. And so that's the reason that this is not separate and apart from the work in which you're involved as Common Council members and representing the city of Racine. So from there we were able to move into what we've called our Community Action Plan. And as I mentioned, there's a summary of that in the booklet. It focuses around community engagement. And that means that it cannot be one sector, because it's not just a public health issue. It is not just an education issue. It's really something that permeates in every area. So it affects the economic situation and what that means. It also affects how we deal with issues of mental health. it is in all of those areas that we need to be able to see how is it that we move forward and improve. So the importance, though, of sharing the message is number one. Because if you live in a community and you don't understand that this is one of the fundamental concerns here, then you don't really react. And so the importance of understanding becomes important. And so when we talk about mobilizing the community, it is certainly for everyone. It is for people who live in this community who, as I say, may not, on a daily basis, it is not a part of their work to be involved in it, but it is a part of what impacts them on a daily basis. So the degree to which they understand and want to come together and help in problem solving becomes important. Coordination is the other part of this. We understand that sometimes it's not about the new program or about the new initiative, but it's how do we really take the pieces, parts, and elements of the work that we're already doing and have it coordinated in a fashion that makes sense. And then there's the advocacy piece of this, which we think about advocacy as really trying to understand public policies and systems in ways that we can really create change that will, again, impact on the outcomes that exist for the community. And so from there, we have moved forward and we're looking at what are our priorities? How do we then take the work that we did in really looking at the issue, understanding what are some models from other communities that have had impact, as well as with guidance from some of the work, again, from the partnership in looking at what are some of the valuable kinds of projects, resources, methods that have been utilized to, in fact, create change. So we understood that one of the things was that the collaborative worked. And it works because it was a convening place for folks who came outside of their regular circles of influence. So in other words, it was healthcare providers talking with social service providers, talking with folks in government, talking with folks like me, and we were able to have some shared dialogues that helped us to move forward, and that shared learning process as well. It became an opportunity also for us to look at what were some of the initiatives that were going on in other parts of this country that had similar kinds of issues and had really begun to see the change take place so that this is not an impossible dream that we're holding. One of which has already begun here is the Birthing Project. And it is a model of African American women under the Professional Women's Network who are volunteers who work to mentor other women. And that mentoring process came out of a project actually in California. It has a lot of research behind it, and we're pleased to say that in the time that that program has been operating, for those women who have been involved in the project, every one of them has had a successful delivery and has been able to have a baby born at a birth weight that exceeds 6 pounds. So that's really a high level of success to say that you have 100% positive outcomes. Racine also has the home visitation programs, and what's important about that is that while you've had these programs and there is high value in them, that now there's been some agreement about using a particular model that's called Healthy Families America, and that for those programs that they're working and talking together, and that's again that coordination piece. Nurturing Fathers, that's operated by the YMCA, is focusing on being able to help develop and support men in their roles as being fathers and being supportive of the mothers of their children. Centering Pregnancy is a project that actually looks at how pregnant and expected women can be a support to each other. And so it really is about how they come together. It is, again, an evidence-based, lots of research behind it about the value. And currently, it is a model that is being looked at and is actually under development here in Racine. And we also know that adolescent pregnancy prevention is a key factor, because while we go back to that life course, and the decision isn't an issue that is focused clearly just upon teen moms, but it is certainly important the degree to which we can prevent young women from getting pregnant before they should, and providing them with that information and being able to see that they have healthier outcomes means that when they do move into a stage of life where they're going to get pregnant and have children, that they can be better off. And so at this point in time, we are in conversations. We were actually approached by the Medical College of Wisconsin about being able to coordinate this project. I mention that too because one of the strengths then of the collaborative is that the medical college knew where to come. They knew that the collaborative was a place that they could come to begin to have this conversation and figure out who needs to be at the table, how do we bring them together, and how do we coordinate this. And they've been actually very excited just even about the opportunity to understand that there's a place that they can come to and share this information. So for 2014 and 15, we're looking at also models, one that's called Health Leads, which again is a volunteer-based model with college students who can help when mom goes to the doctor, and we know that physicians don't have a lot of time to take these days, and so they can actually write a prescription, if you will, for the kind of support that this mom needs, and the volunteer will help to see that they get to the appropriate kinds of resources. The Northern Manhattan Perinatal Project, as well as Neighborhood-Based Family Success Center, easy for me to say, are examples also of coordination in communities and really stress how can we have a community approach to see that services that are being rendered are coordinated in a fashion that folks can get to them, get the benefit of them, and have better outcomes. And then Baby FAST, FAST stands for Families and Schools Together, but they also look at a model piece that's about dealing with infants, and it's an intergenerational model where we look at the maternal grandmother, the father of the child, the mother, along with whomever else may be a part of the family dynamic, who may be in a stressful situation, and the idea is that they're working through a model that is for the sake of the baby. So whatever stressors are going on, that they're able to mitigate them. So those are some of the things that we're looking at, and I think what's important as you've listened to this, that it's not just about the money, that it really is about a community effort, and it really is often about volunteerism, and it really is about the kinds of things that can have impact. So we need to be able to evaluate and come back to you and say, we're doing well. And in fact, we're doing better, and this community is healing. And we'll know that because we're going to look at how those individual projects are faring. We will also look at the impact of the collaborative. So as I just talked about, a place to come and a place to coordinate and a place to understand about who can be involved, we'll be able to continue to look at that work, as well as what's the actual change, what in fact does the data show for our community. And what will success mean for us? It'll mean that we have children who are healthier, who are ready to go to school, who can be successful, and this, of course, impacts largely on the community. We can have healthier folks involved, and as they are healthier, that means that we'll also be able to look at a community that is thriving, not just getting through, but actually beginning to turn this paradigm and see that we have a thriving community.
So one big question becomes, what can you do? And we always like to share with folks what they can do about this problem. And I'd like to point out to you that the first thing you can do is continue to build on the neighborhood assets that exist. And I don't know if you can see on the map, we have a section of the city, census tracts 3, 4, and 5. There are assets in those communities, in those neighborhoods. There are things that matter for creating a healthy life and so forth. But there are also some things that are missing. And we'll come back and talk about those in a minute. But you see there's assets all over, and I hope that in the small maps that you have, you can see them, and if not, we'll be glad to send you bigger ones. So you can look at and see, because there are a lot of things going on in this community that are very positive. And actually, you all have done some very positive things. The community garden work that you all have been reinforcing and allowing different community groups, particularly Rugen, to create gardens in little pocket parks and so forth is phenomenally important. For this year, for last year, for next year, and for the people that live in those neighborhoods, the access there is crucial. Many of you may remember, some of you may not, Back in 2008, the city fire department, started by one paramedic, but bringing in the fire department, the police department, Next Generation Now, the city health department's Healthy Birth Program, got together and said, we don't believe our babies ought to be dying from co-sleeping. And these folks, on their own, they didn't have a whole ton of money. They raised it among themselves. In addition to a little bit of healthy birth money, they established the Safe Sleep campaign. They had billboards, they had ads, they had a lot that went on. And you know what? Since they've done that, for the last 3 years, there have been 0 babies in the city of Racine dying from co-sleeping. A very different story than our friends to the north in Milwaukee. But those guys and gals in city departments are really to be thanked for that. We also see the co-location of a fresh produce farmer right there at the WIC office, where women can take those fresh vegetable WIC coupons right there and go home from that prenatal check with the fresh food that they need for their children. And all the work you've been doing for a really long time in terms of lead abatement really does make a difference for children. It's a constant battle because as we know, we have lots of homes in this community that were built before, 1960, 70? 78. Mine was almost 100 years before that. So was Eric's. But anyway, we do have some things on a list that we would like for you to be thinking about as you're looking at policies that come up, suggestions that come to you. We would strongly encourage you to continue the expansion of those community gardens. Seriously, and the more often they can be expanded, people can grow their own food or receive the food from those gardens, learn how to cook it in new and healthy ways. Bless you, Michael. And cook it in new and healthy ways. You are helping to establish a healthy lifestyle for children and their families, their parents. We need, and if you look at the asset maps, you'll see we really need some fresh food markets in some of the neighborhoods in census tracts 3, 4, and 5. 2, 3, 4, and 5, if you will. There's not enough places to get really fresh, good food at a reasonable price. We would encourage you to limit expansion of the availability of unhealthy products. For example, liquor is one, cigarettes are another. Do we need a whole lot more of those places? You really have to ask yourselves that. We would strongly encourage you, underline, to continue the development of the COP houses. Those have been the most remarkable, and you all did them, the most remarkable enhancement for community safety and people's sense of well-being. We probably need a couple more. I know they're expensive, but what we also need to do is expand the use of the ones we have now in terms of engaging, and I know the police department works really hard to bring in people from the neighborhood into those cop houses. We've got a wonderful community garden that's part of the, I don't want to call it an annex, but right down the street from the Villa Street COP house. Wonderful idea. The after-school programs that are run through those. Fabulous. We're connecting children and police officers in enhancing the sense of safety and security in those neighborhoods. Outstanding. And of course, we would continue to encourage you to support the neighborhood cleanup activities. It doesn't have to be money. It's ads. It's telling people, get out there. Let's work together. Let's clean up our yards. Let's do whatever. And support and encourage family-centered activities. Anywhere and everywhere we can get them going. And to encourage community engagement in every aspect of our life. The more people are connected with our city, the more people believe that its leaders, its systems want them involved, the more likely they will be to be involved and to commit themselves to being good neighbors, good residents, and good citizens. So with that, I would like to remind you of this, what we think is a truly wonderful and powerful proverb. If you want to go quickly, go alone. But if you want to go far, go together. And that's very much what this collaborative has been about, going together. And I just want to let you know that this group of 120 or more, we grow all the time, is truly one of the most incredible groups of people I have ever worked with. And I'm old now, so I can tell you, this is a stunning thing. There aren't issues in this group that you typically see in community groups and in community-based activities. And some of you will know I've been involved in a lot of those over the years. This group is beyond a doubt the most phenomenal working collaborative I have experienced. And there aren't the barriers, and there aren't the judgments, and there aren't the assumptions made in this group that you so frequently see. And it's been so powerful and so refreshing. We invite you to go to our website, but more importantly, I think we maybe didn't talk the whole time you gave us. We would love to hear any questions or comments or anything from you.
Okay, one moment. Thank you very much. It was a good presentation. For those of you who are watching us at home on Car 25, I asked the producer to put up the website on the screen, so that's running across the bottom of the screen. It's healthybabiesracine.org. And just to quickly focus on a couple of things that people can do, there's a community forum coming up on April 25th, and there's more information about that on the website. And then there's the April showers thing that was mentioned at the beginning, and they need donations of new baby supplies for mothers in need, and more information again about that is on the website. So with that, I thought I saw Alderman Shakur on deck first.
Thank you, Mr. President. Ladies, I'd like to thank you for a very fine presentation. I just got a quick question and a comment. First of all, I'd like to say it appears to me without a doubt that the community action plan is moving forward, and it's a good thing. But my question is, as far as unemployment and fatherhood and stuff like that, I know that women sometimes have children by themselves, and that's very, very difficult. Getting to the point, though, I know for a fact that there are fathers out here that's got 5 to 10 kids by different mothers, okay? So, again, getting back to the stress situation, for a woman to go to have a baby by themselves and to know that this father could be splitting his time between 5 to 10 other babies. And just to even say within Kenosha, I talked to a lady that said she had 27 grandkids. She's got 3 sons, and each one's got 9 kids. That's an issue not only for the birth of children, but I'm sure it causes a big problem for our chief of police, too, with situations as things evolve. But that's my question.
I wanted to respond if I could, and then I'll let my colleagues as well. Alderman Shakur, I appreciate the fact that there are cases like those you mentioned. I do not, however, believe that it is the majority of fathers who are behaving in that way. And while it may sound flip, maybe our pregnancy prevention program might help with that. How do we stop that? I don't know that we can. But do we punish the woman? I mean, do we punish the babies, actually, are the ones that end up suffering? We have to do something. And it is a reality, but I think the number of cases is relatively small. Yes, there are some exactly like you're describing, but I don't believe it's the majority. You guys want anything?
Well, I would just add to that. I mean, I do agree with that, but I think that when Carol talked about the pregnancy prevention, I mean, what's critical in any pregnancy prevention program is really a part of how women value themselves. And so the degree to which we can provide that earlier support that is helping them with their strength, their health, their self-esteem, their personal health, all of those kinds of things that improve and help them to see a longer-term outcome for themselves, I think really moves in a direction of seeing that they're going to make some better choices about who it is that they're choosing to have in their lives in that manner. And I think that in relationship also to the fatherhood, while there certainly is that potential that you've talked about for some of these men, there are also some men who do not have that number of children but are struggling even with the 1, 2, 3, or 4, and particularly if it's out of wedlock they really want to be good fathers. And I've had this experience. And part of it is that they may not have had that benefit in their lives. And so they really are pretty enthusiastic about the opportunity to be able to really engage and be thoughtful and work through about how can they really connect in a productive way with their children, and understanding what that may mean in terms of even negotiating a relationship with the mother. And so part of what happens a lot of times is the capacity to be able to really look at how there is that kind of mediation and negotiating so that parents can move to a place of really being able to focus on the healthier outcome for their child, regardless of what their relationship has been like.
Good. Okay. Alderman DeHaan.
Yeah, my question would be is how much access do the people without funds have to pregnancy care within our community? And what I've seen in my 20 years as a bus driver is a lot of them don't have much income, or they don't have any support. And I've seen that happen time and time again. But and my concern is, what is our community doing besides All Saints? Is the State Street group doing anything? You know, are there resources out there that people are not accessing?
I think it depends on what those resources are. The Baby Express that was shown in the video, actually that is a company that was created in Racine after one of our collaborative meetings when we brought the mobility manager from the county in to talk about issues related to transportation. She got together with him, and within 4 or 5 months it actually established the company. She and her husband run it, and they're doing really well. They're very, very busy, and they transport pregnant women and their children or whomever with them, because that's one of the big challenges is, what do I do if I have another child? What do I do with them while I get on the bus to go to the hospital? I can't let my kid run around in the lobby at the medical center. So that is one part of the solution. Also, the Sister Friends Project that Sharon spoke of is another support that is supporting these women. And even the home visitation program that actually we've gotten a big one funded by, Racine has gotten one funded through the Department of Children and Families that has, the funds go to Racine County, but they are redistributed to 2 providers here that are doing in-home visitation with pregnant moms and connecting them with the resources that do exist. We would certainly welcome and love folks like the State Street Association and other, Douglas Avenue Association and so forth, to join with us and work together in trying to figure out some of these challenges.
Okay, Alderman Fair.
Thank you very much, Mr. Chairman. One of my questions that I had for you, but thank you very much and stuff for your presentation, because I believe that is long overdue. You know, I've had a conversation in the past with the health administrator, and she's been helpful in kind of educating me on this particular infant mortality. But I visited one of your collaborative meetings at Wingspread, and I remember one of the ladies that was up speaking, and she had said, we need a commitment from the elected official or the government officials of the city or the county, you know, and we need a buy-in, that sort of thing. My question is, since you have a collaborative of organizations that are lending themselves to try to lower this infant mortality, do you know, or can you find out for me, are some of those partnerships or collaboratives coming before the CDBG committee on this particular term?
I could find out. We haven't been, I undoubtedly, because I think some of those organizations have been before for CDBG before, but I can certainly find out if any are. I personally do not know. And we didn't come here tonight to ask you guys for money or whatever.
I understand, you know, that, but you know,
but I can certainly find out.
I would like to know that.
We can certainly find out.
Because this is a very serious, you know, and it's a very sobering type of presentation. And you know, you know, personally as an Afro-American man, would like to know what are we doing as far as prioritizing ourselves from a city standpoint of view to remedy and to lower some of this mortality rate.
We will certainly do that, and I will. How do I? Would you all like that?
Debbie,
I mean, do I send it to you?
Debbie Embry is on the CDBG committee. I'm counting on her to make the committee aware of which of the programs, you know, are, I guess, recommended.
I would like to know.
Oh, of course, yeah. And lastly, Alderman Wisniewski.
Thank you, Mr. President. Thank you for the presentation. I know we're bumping up against the end of this meeting into the next one. This is an important issue, so if we run over a couple of minutes, I'm sure that the mayor will grant us those couple of minutes. But I wanted to point out the pamphlet that you handed out and the importance of it. It starts with the, you know, changing perceptions. It seems to me that this is absolutely key to beginning to educate the community about the problem, which is what one of your first slides really talked about. Is simply reading through this, you come upon, you know, item after item that is completely counterintuitive to what I think most people in Racine would assume. Well, the problems are this, the problem is that. And it turns out that the data, not just somebody's off-the-cuff remark or feelings, but rather what the data actually shows is something completely different. This is an excellent starting point, and I really thank you for sharing that with us. As far as what we, the city of Racine, can do to help this problem, especially the 15 of us here in this room, it seems that you say it over and over again, and that's consider life course impacts on your decisions, all right? And I see that linking to those last couple of slides where you said examples of positive city actions, things that we've already done. And I see a possibility, as the Alderman of the First just recommended, of being able to leverage funds that are available to us, maybe through federal dollars, CDBG. You already gave the example of the community gardens. This is a place where our Department of Public Works, not even our health department, but someone like Public Works or the Parks Department can actually go after those CDBG dollars for the purpose of setting up the sort of bricks and mortar that are needed for things such as community gardens and spots where you can have the location of fresh produce markets. I also, however, really wanted to key in on something that you did bring up that has been a concern of ours in this council for many years, and that is limiting expansion of availability of unhealthy products in our community. There's a constant push and pull in our community for this kind of thing, saying, well, we shouldn't limit the number of outlets for alcohol or tobacco, especially, in the city of Racine. Although we also see that there seems to be a predominance of them in the very census tracts where you're pointing to the greatest problems. And I would ask you and your collaborative, the community collaborative that you're talking about, to please come back to this body more than once or twice a year, monthly if it need be, and weigh in on the introduction of new unhealthy product outlets that are opening in our city. It happens every couple of months. Many of us serve on those committees that recommend these kinds of things. Weigh in on that. Let us know what impact you see in the very community that you're trying to help, and help us. I guess I'm asking for your help in helping us, guide us, and make better decisions for the communities that you're trying to help.
We'd be glad to do that. And just to piggyback, one more thought. Please consider strongly building on the assets we have. We have many, many, many assets in this community. And we need to stop tearing it down and start building it up and build on those assets. And we will be delighted to come back to you.
Thank you. And with that, I would thank you guys for your presentation and all of the good work and the good results so far. We look forward to more of that, and I would entertain a motion to adjourn.